You know what? Wait. And just listen to your heart for a moment. You know, just so you can tell us what you feel. Emeka and Nkechi, I'm sure you people have heard the rumor that heart disease can only happen to that your old neighbor or your uncle that loves junk. But the truth is, heart disease can happen to anybody. And the signs are not always clear. It needs to hide somewhere. And that's why we're here to share them with you.
Hope I'm grateful. With a little bit of neck and jaw pain. I know it's nothing. I'm about to have a heart attack.
It's barely 8:30 in the morning and I'm already tired. This is not the sign of a heart attack, but in about 3 minutes, I will have a heart attack.
This is actually my 3rd cup of coffee. And I'm still having cold sweats. Is this a sign of heart attack? But before I leave this kitchen, I'm going to have a heart attack.
Now, some of you may be wondering, what exactly is a heart attack? Is it from the village? Is it from Babalawo? Is it just because? Let me first explain it. First of all, you see these major blood vessels. These ones are responsible for supplying the rest of the body. This big one you see here is the overarching aorta, right? After this, there's these ones that go to the head. When it goes down, there's some that go to the legs. But you also need to understand that the tanker that brings fuel to the filling station also needs fuel in itself. So the heart itself needs blood supply. And where does it get it from? It gets it from this, you see these small blood vessels that are here. Yep, that's where it gets its own blood vessel. Now, if anything actually blocks any of this vessel, it could prevent the rest of the muscle from getting blood. Bam, heart attack. And the feeling is different for each person. But there are common signs that you should be aware of. For men, you might notice sudden cold sweats, right? Discomfort in the back, your shoulder, your arms, your neck, or even your jaw. So and then chest pain, or you want to feel like vomiting. For women, you might actually notice neck pain, jaw pain, or just tired all of a sudden, vomiting. You might feel like you're having indigestion, like there's something sitting down on your chest, or there's tingling in one or both of your arms. So what do you now do in order to prevent heart attack? It's very simple. Make sure that your blood pressure is actually in a healthy range. Make sure you're eating a healthy diet. Avoid junk food because these things can raise your cholesterol level, putting you at risk. Make sure your weight is okay. Make sure you don't smoke. Make sure you don't drink alcohol. You're getting enough sleep. And most importantly, measure your blood pressure on a regular basis. And last but not the least, ensure that you always check yourself. Once a year, once every 6 months, depending on how frequent or at risk that you are. You also need to understand that a heart attack can threaten your life. And remember that the faster you get medical attention, the better chance you have of making a good recovery. You also need to understand that this heart disease is now common. It does not respect your age, your gender, or your profession. A word is enough for the wise. If you finish this video, please like, subscribe, so you don't miss the next one. Happy Heart World Day. Happy World Heart Day. Yes.